Hi, thank you for attending the Osteoporosis Start Now presentation. My name is Adrian Taylor. To give some background information on myself, I have my Bachelor's of Science in Exercise Physiology from Florida State University. During my undergraduate studies, I did an independent study course in advances in bone research. I'm currently working on my doctorate in physical therapy here at Florida Gulf Coast University. So for the next hour, we will be discussing what osteoporosis is, the prevalence of osteoporosis in the United States, causes of osteoporosis, risk factors for osteoporosis, information about the science behind bones, how nutrition and exercise impacts our bone health, how risky behaviors such as smoking and excessive alcohol intake and other negative behaviors impact our bone health. And lastly, we'll discuss the campus resources here at Florida Gulf Coast University that can be utilized to help reduce our risk of osteoporosis. Hopefully today, everyone here will leave with an understanding of what osteoporosis is and why it's important that as young adults we begin to incorporate healthy lifestyles that can help to prevent osteoporosis in the future. So, what is osteoporosis? Osteoporosis is a metabolic bone disorder, and it essentially means porous bone. There are two types of osteoporosis, including primary and secondary. Primary is most common in both males and females. Secondary osteoporosis is a result of use of certain medications and some conditions such as spinal cord injuries. So, the incidence. It is the most common metabolic bone disorder as mentioned previously. It affects approximately 10 million people living in the United States. And additionally, 34 million Americans already have osteopenia, which means they have a low bone mass. It affects women more than men, especially postmenopausal. However, there is a growing concern in the male population. Approximately 2 million men are affected by osteoporosis, typically the type 2, and another 12 million are at risk for osteopenia, again, low bone mass. 1 in every 2 women older than 50 will experience fragility fractures secondary to osteoporosis. 1 in 4 men will experience an osteoporosis-related fragility fracture during their lifetime. When men have osteoporosis, they have a higher morbidity and mortality rate than women when affected. So what causes osteoporosis? Well, the exact cause of primary osteoporosis is unknown. But we do know that decreased levels of calcium, estrogen deficiency, as seen with menopause, and sedentary lifestyles are risk factors. Secondary osteoporosis can occur as a result of prolonged use of certain medications, or alcoholism, or excessive alcohol intake, malnutrition, or poor nutrition. There are some risk factors for osteoporosis. They can be divided into modifiable and non-modifiable, meaning things we can change and things we can't change. So, the non-modifiable risk factors include age, typically 50 years and older, ethnicity, Caucasians and Asians are at a higher risk compared to African Americans, menopause, family history, and depression. Modifiable risk factors include physical inactivity, use of alcohol, tobacco, and caffeine being greater than 3 cups a day, a low body weight or a thin, small frame, diet and nutrition, and certain medications and conditions, as previously mentioned, spinal cord injuries. The bone structures at the highest risk for fracture as a result of osteoporosis include the hips, wrist, and spine.